He's a professor of neurology, a renowned cerebrovascular neurologist and stroke geneticist with several NIH-funded trials, Swiss and ISGS, and now going to update us as a principal investigator of a very large carotid disease trial called CREST-2. Please welcome Dr. Meschia.
Thank you for that introduction, David. This is going to be a very focused talk on a particular trial, and that represents the largest trial in the world to prevent primary prevention of stroke in patients with large vessel atherosclerosis. So I have nothing to disclose other than that I received support from the NIH to get this trial done. So let me start by focusing on the fact that carotid disease currently is classified similarly to how you might order an ice cream at a limited ice cream parlor, which is that it comes in basically 3 sizes and 2 flavors. And so the first thing is the sizing of carotid atherosclerotic stenosis. It's been long observed that patients are at highest risk of stroke if they have the greatest degree of stenosis. The patients who usually present with, for example, retinal or hemispheric TIAs in this setting of carotid atherosclerosis often have so-called flow-limiting stenosis, which happens at about 80% cross-sectional diameter reduction. There are basically 2 ways the trials have classified stenosis, and to some degree this has added to the confusion in the literature, but there's the way that was used by the Europeans in the European carotid surgery trial, which you see on this side, and the way the North American surgical carotid endarterectomy trial measured it. So the way it works is you need 2 diameters, essentially, to generate a percentage. And in the European approach, you take the inner diameter, the A diameter. That's the same for both ECST and NASCET. And that represents the point of greatest narrowing, or the smallest diameter you can get out of the plaque. And then the denominator is where the difference occurs. So the denominator in ECST is estimated based on the greatest diameter you can generate from one wall of the plaque to the presumptive